We're here today with Willem van Rensburg from our Meritas affiliate in Mauritius. Willem, welcome back. Nice to see you.
Thank you very much, Mario. Nice to see you again. Thank you very much for the opportunity.
No, my pleasure. So Willem, let's dive right into what is certainly an area of your expertise and something that is really important for the industry on a global scale, because we touched upon it in earlier conversations between you and I, but today's episode will really focus on the UN conventions and what impact that can and is having on the global cannabis industry. So really, let's just begin at the beginning, as they say. Can you tell us a little bit about sort of the history of the conventions and how cannabis got to be in there and what the state is now? Maybe that'd be a good place to begin.
Right, Mario, I'm going to do this part as short as possible because I want to get to the solution instead of the problem. But unfortunately, we always have to start with the conventions as being a problem at this stage. Now, drugs are regulated by 3 international conventions. These are the what we refer to as a single convention on narcotic drugs, which was signed in 1961 and updated later. 1971 convention on psychotropic substances. And then the 1988 UN Convention on Illicit Traffic in Narcotic Drugs and Psychotropic Substances. So if I could just shortly, and this is very simplified, the single convention regulates drugs. The 1971 convention regulates substances that are used in the manufacturing of drugs. So that cover your synthetic drugs. And then the 1988 convention covers everything to do with the supply chain of drugs. In other words, trade of it, transport of it, splitting of it, and all of that. So that's a very simplified version of the 3 conventions. Now, the conventions started as talks in as early as 1935, 1945, and between countries who felt there needed to be some regulation of drugs in general. And South Africa, for instance, was one of the countries who highlighted its perceived danger that cannabis would hold, and Egypt was also one of the first players. But really, at the end, the conventions were driven by the USA and Russia and bigger entities like these. And somewhere along that route, it was decided that cannabis was the worst of all drugs, one of the worst of all drugs. And there was no actual scientific study to support this. It was more of a maybe the sign of the times or the perception at the time that cannabis was wrong and cannabis was a bad drug. It made you crazy, that some said, and all sorts of things. And this was not based on any science. But as a result of this, cannabis was placed
on that it was widely available, or that was used in maybe, let's call it maybe not popular culture, but that it was maybe a known drug at the time. Would that be why it made it on the list from your analysis?
Yes. Look, firstly, all drugs were supposed to be covered, and so that was the intention, and it's also what happened. But cannabis was widely known, and in some countries it was experienced as a major problem. But for instance, in the USA, it was perceived as a problem associated with poverty, and there was concerns about classes of people mixing these drugs and getting involved in cannabis. So it was basically perceived as a baseline bad drug, and also very addictive. And on top of that, it was also seen, and some people still today see it, as a gateway drug. You start with cannabis and then you go towards more serious drugs. So it was in a big way politically motivated, and motivated by perception at the times. And unfortunately, cannabis was really affected maybe worse than many other drugs, because the conventions contain schedules. So drugs, according to the danger that they have and the addiction, how easily you get addicted to it, is grouped in schedules. And cannabis was grouped in the worst of these schedules. The worst, for instance, heroin was scheduled with cannabis. So not only did cannabis make it onto the drug convention, it was also really put in the really, really bad corner of the conventions. So at the moment, the conventions didn't change much. The conventions are still the way they are. The 1988 convention being the last one. The single convention being the first one that was signed in 1961 was amended in 1971, and that's the last of it. Now, some small concessions were made, but the conventions, the wording of the conventions didn't change much. In 2020, cannabis was finally, after much of a struggle, declassified, and now it's not in the most strict schedule anymore, but it is in the a little lower. It's still in the schedules of cannabis prohibition. It's just not in the very worst of schedules. And the difference this brings is that the schedule where it was pertained to drugs that had no potential value to humanity, for instance, specifically medicinal value. And now it was recognized that cannabis actually does have, or could have medical benefits. And this obviously is long overdue, seeing as how many countries have already legalized cannabis for medical purposes many years ago. So this is where we are at the moment regarding the conventions. Now, the last thing that I can say about that is that the approach of the conventions was to eradicate all drugs. So we referred to those conventions as the prohibitionist approach. So we will prohibit everything, no use, no trade, no nothing. All possible drugs will be prohibited. So the idea was to eradicate drugs within 25 years from 1961. But obviously that never happened. And over time, some countries sooner than others, but over time, more and more countries came to realize that this is simply not working. You can never eradicate all drugs. And this is why a lot of countries, the shift is happening towards shouldn't rather regulate the drugs than prohibit it entirely. But unfortunately, at the moment, and for the foreseeable future, the drug conventions simply do not allow this.
So Willem, which leads to the next point or question is, we have the conventions as you've detailed and you've given us some detail about them, but we see countries legalizing cannabis. Obviously, Canada, where I am, and different countries earlier, and certain states before. So how is this legalization occurring within the context of the existence of these conventions?
Yeah, this is very interesting. So, for instance, in the Netherlands started doing this in 1976 already, if I remember correctly, and Portugal also long ago. Many countries did so long ago already. But what they did is the conventions specify that a country must criminalize the use of drugs or drugs in general. And what they did is two different approaches here. Portugal said, okay, we are taking drugs out of the criminal sphere instead in terms of fines and punishments. So in Portugal, if you are caught with drugs, you will be punished, but it would be an administrative fine. You won't get a criminal record, or it would be rehabilitation, forced rehabilitation. So instead of having it in the criminal sphere, it is still illegal, but you don't get punished by going to jail or also and getting a criminal record. So that's referred to as decriminalization. And now the International Drug Policy Control, the International Drug Control Board initially was very much against this, but then later recognized that, okay, this falls within the flexibilities of the drug conventions. You can do this because it is still technically illegal. The Netherlands took another approach. What they did is they said, no, it's definitely criminal. We are not taking it out of the criminal sphere. However, to a certain extent, we will not enforce this law. and in the Netherlands, and both of these countries, this pertains only to small quantities for personal use. In the Netherlands, you buy these at licensed places referred to as the Dutch coffee shops. So you can also not buy it everywhere. So this is very restricted. It's a certain freedom that these countries have in terms of that, but it's not a real legalization. It's not a real regulation. It is a, I don't want to say loophole, but it is allowed under the conventions, and these countries make use of these allowances in the convention, or flexibilities, to have a sort of a legalization in these in their countries. Other countries like Spain do the same in a different way, but I don't have time for all the examples at the moment. So this is what countries did up to 2030.
And out of curiosity, let's say you didn't find these approaches. What are the sanctions? What would be what could happen to a country that didn't take the Portugal or Netherlands approach? And maybe we'll get to that later, but the question just popped in my mind. What teeth do the conventions have, I guess?
Yeah, we'll certainly get to it next, because that's what happened with Uruguay in 2013, and that's what is happening with Canada now, who legalized in 2018. But to answer your question, sanctions, we have to remember that when you breach an international convention, you are really breaking international law. Now, you can't put a country in prison, of course, but you can impose sanctions. You can even remove the country from its membership from the conventions. And that is a big thing, because remember, we're talking about cannabis here, but the international drug conventions are about all drugs, not only about cannabis. So if a country, and almost all countries are part of this, all the UN countries are part of these conventions, and some others as well. So once a country is no longer under those conventions, there's all kinds of downsides to that, and you are not protected in terms of any other drug as well. So not to be part of the conventions is also not really a viable option for a country, especially a country like Canada. But as I said, we'll get to that in a while.
Yeah, and so let's then back up a sec. So what issues did you identify, or have you identified, with the approach taken by the Netherlands or Portugal or Spain, the let's call it the walking the line approach, as far as staying kind of on side, but also, as we know, providing some access to patients and or adult use users. So what were the issues with that, or what is, in your opinion, the issues with that?
Yeah, the issues with that is when you walk a line, the line has to be, you can't cross the line. You can walk on the edge of the abyss, but once you go too far, you fall down. So that's the problem, is that you have limitations there. And mainly the problem with these two approaches and others is that you can operate inside the conventions as far as you regulate private use of the product and small quantities. So now let's look at the alternative. If you say that you feel that regulating cannabis is much better than prohibiting cannabis, then you can't restrict it only to small quantities and private use. You have to then regulate everything, and that's the problem. Once you start to say, okay, I want to regulate the whole market, I want to impose rules for marketing, for advertising, for safety of the product, all of these things that has to do with the supply chain other than use. I mean, and this is a problem that they have in the Netherlands, for instance, is that you can buy cannabis in a coffee shop, but who's going to supply it to the coffee shop? That's illegal, because trade is illegal. So who's going to produce it, because production is illegal. So these are some of the limitations. So if you can't regulate the production of cannabis, you can't regulate the trade in cannabis, the supply chain. That is the problem. Then you can't really say that you are regulating cannabis. So the conventions might tolerate it to a point, but not that far.
Yeah, because if I'm understanding, it puts a certain part of the entire supply chain offside, and only the let's call it front end personal use, and kind of removes the sanctions or the penalties for individuals to do it. So it creates a bit of a hybrid a model, which is to be honest something that we had kind of in Canada prior to legalization. So which brings me to my next question. We did see entire nations legalize and regulate everything in cannabis, and the two nations that obviously come to mind are the first two in this and talking about Uruguay and Canada. Can you talk to us a little bit about how these two nations specifically, despite being parties to these conventions, legalized cannabis, regulated all, and now currently have a full-on industry in place at the very least? I can't speak directly for Uruguay, but I know in Canada we have an industry underway. Certainly, it's in its infancy, but it's here.
Yeah, yeah. That's the thing. So what happened in 2013? Okay, let me start this way. We have the drug conventions on the one hand, which is very important and which is the topic of this conversation to a large extent. But on the other hand, we also have the human rights treaties. And human rights treaties, many academics argue, are above the drug conventions. They have to be interpreted in light of the human rights treaties, because the UN Convention states that, or the UN Charter states that human rights treaties are above all other treaties. So what these countries are doing is they are saying that, look, we believe the welfare of our citizens or our subjects living in the country are better protected by regulating cannabis than prohibiting it. So therefore, they are using the right to health and welfare of their society and saying that this is why we believe it should be regulated. To a point, that is also what the Netherlands and Portugal is doing, but they are restricting that to the right to privacy. And the right to privacy allows you to do stuff in private. And that's why that's also a problem. Now, Uruguay was an interesting case because the president at the time decided to, and the government at the time decided to legalize it against the opinion of the public. Most of the people did not want it legalized. So, but there was a lot of, and still probably is a lot of drug wars going around that part of the world. And Uruguay wanted to make sure that it could combat this, that it could produce its own product, which would be safer and regulated. But that is very much regulated by government. It is not the kind of industry that we see in Canada. So the INCB was very, and Russia and China and a lot of countries were very outspoken about this, but nothing really came of it. Uruguay was not banned from the conventions or extradited from it. Nothing happened, no sanctions. But then in 2018, when Canada did it, now it's a different story and the world is talking about it. A lot of shifts was made since then. For instance, the first two US states to legalize cannabis did so also in 2013, Colorado and Washington State. So before Uruguay did it, there wasn't really anybody else who had done it before. So that's very significant. But as far as development is concerned, the world digested that information until Canada then in 2018 decided to legalize. And that's why we focus on Canada, also because it's economically a much more significant world force than Uruguay was. But Canada is also the first country to openly admit that it is breaching the drug conventions. But it is doing so in the conviction that it is better for its citizens to do so. And that is the maybe the difference between these countries, is that Canada is not trying to say, look, we are actually operating within the conventions. Actually, we're not really breaching them because we're doing this or that. They are saying that, look, we are breaching it, but we are willing to cooperate with our partner countries in the conventions to find a solution. And this will take the issue of cannabis legalization forward, because now somebody is finally looking for a solution that hopefully will benefit all countries intending to go this route, and not only one country. Yeah, so that's why Canada did it, and you can see the results of that. But maybe just one final point on that particular question. Academics refer to this state that we are in now as principled non-compliance. So whilst Canada is admitting that it's not complying with the law, international law, it is doing so because of a strong principle that's based in human rights. And therefore, it's not as if Canada is just contravening the conventions because it feels like it, if you want to put it that way. There's a very good reason for it. And this is now the gray area between what has happened, what's happening at the moment, and what's the solution to come, because a solution will have to be found one way or another.
Yeah, no, and I do think we see that not only in Canada, but in several US states. And actually, just yesterday, the Mexican Supreme Court again found in favor of, or against, better said, the prohibition on adult use cannabis, again, based on a human right to access. So we are seeing, and I think also too that and this is my opinion, it's shared by many, but maybe not by some, but that the war on drugs is an abject failure and does more harm than any good. And so we've come 50, 60 years later, and we're realizing that the world is different than what we thought it was in 1961, and that the approaches being taken now of legalizing and regulating cannabis is better for society than prohibiting and imprisoning large swaths of our populations. So along those lines, I certainly obviously agree with the approach taken by the Canadian government on that, but we're still in a bit of a semi-non-compliant. So what is the solution for this, and where do you see things going, Willem?
Okay, when this legalization was discussed, a lot of presentations were made by academics and role players to the government of Canada to find out what the solution would be. And there are only a handful of options that is available for a country intending to do this, and not all of them are practical to use. So I'll just go quickly through a few of them. The first and obvious thing is you can withdraw from the conventions. So you're no longer part of the conventions, and therefore you are not restricted to regulating cannabis. But as I said before, there are definite downsides to this. Apart from being probably the black sheep of the world for doing that, especially if you're Canada or one of the bigger countries. Apart from that, you will then also lose the protection of other drugs, and the intention is definitely not to regulate to regulate and legalize all drugs. We're only talking about cannabis. So to withdraw from the conventions is probably a last resort, and hopefully would not happen. There is also an approach that Bolivia took some years ago when they wanted to legalize coca leaf. Now, coca leaf in Bolivia was a cultural thing. It is a cultural thing throughout history. People has been using the product, but it's also classified as a drug. And there is a provision in the conventions where if you join the convention at the time of joining, you can say, I will join the conventions, but apart from this one drug that is part of our culture and is entrenched in our constitution, we will not have that drug included in our obligations regarding the conventions. And Bolivia, what they did is they first tried to amend the conventions and get permission, which didn't succeed. And then they withdrew from the conventions. And then they altered their constitution, making coca leaf a constitutional right of its citizens. And then it rejoined the conventions with this requirement that, okay, we'll rejoin the conventions, but this time this specific drug is excluded. And that's the only way you can do it. A country who is part of the conventions can't, once it has become a member, amend its own obligations towards the convention. So now that is something that might work, but it's very laborious. It was definitely not taken well. It might not work again. And also, hopefully we are looking for a solution that would benefit not only Canada, but the growing number of countries who are now considering legalization of cannabis. And if all of those countries have to go through this process, it's not ideal. So, but it could potentially work. Another way to do it is to amend the conventions. Technically, it's possible. In practice, it is not, because there are many countries who still have the death penalty for drugs, including cannabis. There are many countries and big role players who are very set against the legalization of cannabis. So to get the kind of majority you need to amend the conventions to exclude cannabis is just not a viable option at all. So that is also not a possibility. Now that brings me to the ultimate, what I hope is the ultimate solution, and this is also the view that academics also hope will work, and that is to create a treaty within a treaty. This is the interpretation of conventions in general allow for this, and it's also allowed expressly in the single convention. So what it means is that certain countries, member states of a convention, can amend the convention as to apply as between themselves. Using this argument, we could say that, all right, let's say cannabis and let's say Canada and some of the other countries who legalize cannabis are still members of the convention, as between themselves and in their own countries, cannabis is excluded from that. So this has never been tried before. This technique has never been tried as far as the drug conventions are concerned. But theoretically, it's possible. There is provision for it. So let's be positive about that. But because if it works, then it also creates the way for other countries to do the same thing, because then you have a structure in place within the drug conventions which only affects cannabis, which only affects the countries who chose to legalize it, and not the other countries, and also protects the conventions themselves. Because you have to remember, if a lot of countries withdraw from the conventions, let's say the USA and Mexico decides to also legalize, that will bring the conventions themselves in a risky area. It could negate the value of the drug conventions as a whole. So that's also something that nobody wants to do. So this is what academics are discussing, at least, and I'm sure, and I know it was also recommended when presentations were made to the government of Canada, to the task force looking into legalization, and hopefully that is the route that Canada and the rest of the world will go.
Yeah, and sort of just to wrap up, Willem, is it maybe that we're really waiting for the U.S. To legalize at a federal level, because then it will be essentially, all of North America, good chunks of South America, and the U.S. would be a pretty strong sponsor of the treaty within a treaty. And even yesterday, I think one of the more conservative judges out of the U.S. Supreme Court, Clarence Thomas, striking down a cannabis case, but said that the current federal prohibition makes no sense to him and just needs to be removed. Something along those lines, essentially saying you have 37 some odd states with medical use, I think 18 or so with adult use. This federal prohibition is illogical and makes no sense. So when you have somebody that is, outspoken on it, a sitting Supreme Court judge, and the current government, would that be your view, Willem, that we're maybe waiting for the U.S. to do what many people are expecting to occur over the next number of years, and then that would kick off the treaty within a treaty? Or is that something that Canada and Mexico and Uruguay could begin on their own? Or I guess, what are your thoughts there as where we are going with this topic, or with the convention issue?
Well, it's a good question, Mario. Nobody knows exactly. It looks like Mexico is set to legalize soon. That's what it looks like anyway. But also remember that countries like the Netherlands and Portugal might also, because it will solve the problem in the Netherlands, for instance, if they could just regulate the whole market. And also some countries in Africa. New Zealand had a referendum. They narrowly decided not to legalize cannabis. They could be a potential member of this interstate treaty arrangement. But as far as the USA is concerned, it's a very interesting topic because it's very clear to academics anyway why this is the case, and that is because the USA was always a staunch supporter and actually probably the biggest pioneer of the drug conventions. It also invested heavily in getting the conventions up and running. It was a very outspoken prohibitionist country, and now it is in a very difficult position. If it legalizes on a federal level, then it is now suddenly turning from it's turning its back on the conventions that it essentially created, which is a problem on international level. And but it's obviously ridiculous, if I can put it that way, because it is only a matter of time. What are you going to do if all the states inside in the federation, if all of these states have legalized cannabis, but it's still not legalized on federal level? So it also causes a lot of problems for the cannabis industry in the US, for instance, getting finance and so on. But hopefully, and I'm sure it will happen, I just don't know when, but it is, I think, inevitable that the US will have to legalize on federal level, as you say, if there's a lot of outspoken people and a lot of people who are very influential and like the judge, for instance, who is seeing this. And the more this happens, the closer we are to federal legalization. So if you look at the whole of North America and you've got Canada and the US in there, that is a force that you cannot ignore in terms of this. So hopefully Uruguay, some European countries, hopefully the US, maybe not soon enough. Hopefully we will get a solution before that. It might take some years for the US, obviously. Hopefully the solution will obviously it's not good for us to be in this state of abeyance, this gray area for too long. We want to find a solution as soon as possible, and I hope we don't have to wait for the US to legalize on a federal level. But I think even the resistance which we might have had 10 years ago from the US, if we talked about interstate treaty modification, will not necessarily be there anymore. And in that respect already, the US might be a kind of an ally in this quest to find a solution.
No, I agree, Willem. Well, with that, we'll wrap up this episode. And again, really thank you very much, Willem, for your expertise. It's something that I think it's often, at the very least, sometimes with the folks that overlooked the UN conventions and the issues that it raises. But it's really good to bring that back as part of the discussion as we talk with other Meritas firms and lawyers, as I'm sure the issue will continue to come up, and more so for other countries and others. But this was really important, and thank you very much, Willem.
Yeah, it's fine. It's a pleasure. Mario, I just wanted to mention one other thing quickly, and that is if you contrast now the regulatory approach that Canada is adopting, because it is adopting the full regulation approach. If you look at the results, and you're in a better position to look at that, you're in Canada, but the advertising is regulated, the safety of the product is regulated. You cannot use any kind of agrochemical on the product anymore. The product is taxed. The minimum age is set. The tax can be used for rehabilitation facilities and for drug awareness programs and so on. So there's a lot of benefits to that. And what you said earlier, I just wanted to touch on finally, is that the policing of this, in an effort to prohibit drugs, the policing that you have to have in place can all be moved to see more serious crimes. And so you're also alleviating the pressure on your state resources as well. So I just think that hopefully Canada will be an example to the rest of the world of how exactly regulation is much better than prohibition. It might take a few years for that to fully transpire, but That's what we are all hoping for.
No, and we're trying. So that's for sure. Thank you again, Willem. We'll talk soon.